Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be covering headaches, and especially migraine headaches. Katie here has had headaches since she's been 9-10 years old. She's had them for weeks on end. That they're blinding. She sees auras with them, gets nauseous, and then the room goes black. She has to stay down for days at a time with them. They get so severe. This is only her 4th treatment, and she came in today, which she has done over the last few days. It's her 4th treatment, and her headaches have already improved substantially. But she doesn't just have migraine headaches. She also has what's called cervical cranial syndrome, which a lot of people call tension headaches. That's that pain you get right at the base of your skull, and then it closes off the circulation going into the brain, cuts the circulation to the brain down, and you get that throbbing, pounding headache. Usually starts in your neck and upper back. But what's happening is the occiput, or the base of the skull, gets jammed down on the y-axis, and it compresses the medulla oblongata, which is the brainstem, and it also influences the blood supply to the brain. Now this is going to be a first on YouTube for her and me in doing the decompression adjustment on the y-axis for the very first time. So she's had 3 adjustments prior to this one. We've gotten her spine moving. Her headaches are improving. There's also cluster headaches too, by the way, we didn't mention. So you've got migraines, cluster headache, tension headaches, cardiovascular type headaches, cervical cranial syndrome, tension headaches, stress, sinus headaches. There's a number of different causes for this, but really the bottom line is it's all coming from neurological interference. So we're going to be clearing her entire spine from her skull all the way down to her pelvis first on the y-axis. Now she's never had this done before, so you will get to see a real reaction of a first-time patient who gets manual spinal decompression on the y-axis. You notice I bring her legs up to where they're parallel with the floor. This will relax the lumbopelvic and paraspinal musculature all the way from her pelvis up to her cervical spine. Now we're going to have her keep her jaw together and closed. I just wrap this towel around, and I'm going to watch her breathing. Take a breath in through your nose. There you go. And just let it all the way out. Just like that. Very good. Excellent. Now, she actually did great. Just leave your head back there. I know it feels like I knocked the air out of her, but see, she's still kicking. Very good. She did great for her first time. I tell you, women are usually a lot better at this than men. I have pro athletes that I do this on that didn't take that as well as you did. But see how easy that moves now because we have taken that compressive stress off. Now, she felt that a lot through her entire rib cage and all the way down to the base of her spine, right? Yeah. And she's doing really good to smile right now. And see, we always make sure and check the reflexes to let them know we don't have any heads on our trophy walls in the back room. But they're still moving. Very good. First time decompression. Excellent. Now I'm going to have you kind of roll on your side, and let's go over here and lay on your tummy for me next. Turn sideways. There you go. Perfect. And then push yourself up. Yep. Nope. Let's come over here. There we go. Now I'm going to put her head down just a little bit here. How'd that feel? Pretty dramatic, huh?
Oh, it's different.
Yeah, we like to have fun. She's in the healthcare field too, if you couldn't recognize it. She's wearing her scrubs as well. Now, her low back has also been giving us some problems. Now, she has a little bit of shortness in her right leg now, but it was 3/4 of an inch initially. Now it's only 1/4 of an inch. But it tightened up when I brought him up, and she's tender right here on the right sacroiliac. Perfect. That's the right sacrum. There's the middle sacrum, the left sacroiliac joint. And now I'm going to adjust right straight down into the Z-axis at L5 and L4, L3, L2, and you notice how the angle on my arm's changing as long as the spine is changing in its curves normally. And we're going to do these real easy. I'm going to let her head down just a little bit more right there and scoot up in there just a tad. Excellent. And she's just breathing normally now. Great. Good job. Now what we're doing here is we're manipulating her thoracic spine with her ribs. And she is moving on every single thoracic spine vertebra, which is great. We got one more right here at T12L1, right there. Good. Now, legs are exactly even. That didn't hurt as bad as the first time up, does it?
No.
Very good. Okay, we have already separated her occiput from her atlas. Her neck is feeling good, except for the knots that she has here in her shoulders. I think we're going to take these out and play golf with them this evening. So, this is your Houston chiropractor, Dr. Gregory Johnson. If you've got a headache, you should seek chiropractic care. We'll see you next time.